Let's talk about antibiotics and ingrown toenails and answer some of your frequently asked questions about it.
Can antibiotics cure an ingrown toenail? And the answer is no, they can't. An ingrown toenail is caused by a splinter of nail penetrating the skin, acting as a foreign body. That's what's setting the infection up in the first place, because that entry point into the skin where the skin has been pierced by the nail is what's allowing the bacteria in and that infection to get set up. That foreign body, that splinter, has to come out in order for the skin to recover and the infection to be cleared. You might have antibiotics as well as having ingrown toenail surgery just to help clear up any of that bacterial load, but it's the ingrown toenail that has to come out in order to get rid of the infection ultimately. Can antibiotics be used to treat an ingrown toenail? The answer is yes and no. Antibiotics are helpful in the acute stage where you've got swelling and maybe pus or oozing from the wound to help reduce the bacterial load, but at the end of the day, the ingrown toenail itself needs to be removed because that's a foreign body, like a splinter, that's causing the infection to be set up in the first place. What antibiotics treat an ingrown toenail? Good question. The most common antibiotic that you would use as a first line of treatment for that would be flucloxacillin. However, some people are penicillin sensitive, and in that case they would probably be prescribed erythromycin. Even if you have antibiotics for an ingrown toenail, it is still very, very, very important for you to have the nail splinter itself removed, because it's the foreign body that's penetrating the skin, that's causing the skin opening, that's allowing the bacteria in, that's setting up that infection. So even if you take antibiotics, it's not going to fix it. You still need to have that part of the nail removed so that you can get rid of that infection and save yourself taking second course, third course, fourth course and wondering why it's still there. It's still there because you've still got the splinter, and that's got to go. The best thing that you can do to get rid of your ingrown toenail is to seek treatment to remove that splinter of nail as soon as possible. A podiatrist is an excellent person to help you with that because we treat people's foot problems all the time. So we see a lot of these. We have a high level of expertise in doing them because we do them a lot. That's what we focus on. So you need that to come out as well as taking your antibiotics to get rid of the actual infection if it's already oozing or swollen or weeping or whatever. The splinter has got to come out. Just the truth. Sorry. Find a podiatrist, find one soon, get comfortable and get past this ingrown toenail that's stopping you from doing the things that you love to do. Hope that helps. Bye for now. The answer is yes and no. It can be used to help downgrade the best thing that you can do to get rid of your ingrown toenail that's oozing goo or pus or fluid or